Life is far from routine when you are in the hospital, as many can attest. The experience is even uncanny when at a public health facility, be it a hospital or a health center, especially for serious medical attention. Many stories, both good and majority grim and ghastly, are told every other day, but often it is until you experience firsthand that one chooses which version to go with. According to several policy documents, Uganda's healthcare system, not used by the policymakers themselves who routinely frequent private health facilities or fly out of the country to receive treatment, is in a better shape, albeit with a few challenges. But that is until one has a serious health matter to attend to that reality hits. Like in the case of Kevina Gitama, whose 32-year-old son David Wabusimba was involved in an accident 4 months ago and left half dead. Upon arrival at Mbale Regional Referral Hospital, they were simply told that he had suffered internal bleeding to the brain, which required surgery.
We first took him to Butiro Health Center. They told us his condition was critical for them to handle. They then referred us to the main hospital in Mbale. But on reaching there, the doctors kept us waiting.
Then medical personnel disappeared on them.
After scanning his head, they told us he had suffered internal bleeding, but they never told us what to do next. As we chased down the doctors, a well-wisher recommended us to a private clinic, which they said was affordable. On reaching the clinic, they asked us for 4 million shillings upfront.
Then Aduguda, among the schemers, always lurking in the shadows of the grim and ghastly corridors at Mbale Regional Referral Hospital, recommended them to a private medical facility. Months down the road, Wabusimba's condition has never improved. He remains in a vegetative state, while his relatives have since resigned to fate.
Imagine I borrowed to raise 4 million, but his condition did not improve, and yet the doctors are now pressuring me for their money.
Year in, year out, such grim tales have abounded at Mbale Regional Referral Hospital, where a cartel of hospital personnel launder patients and services to the fly-by-night clinics mushrooming at arm's distance from the main hospital. In September 2022, the State House Health Monitoring Unit and police swung into action following a Daily Monitor and NTV expose on syndicated bribery and extortion, medical workers and private clinics selling patients and services, among others. The operation resulted in closure of several fly-by-night clinics in the vicinity of the hospital and arrest of 15 suspects. 2 years later, it was business as usual. More clinics are in operation, and cases of dubious referrals abounded, except this time round with medical personnel treading carefully. In early August this year, the State House Health Monitoring Unit yet again pitched camp at Mbale Regional Referral Hospital to investigate increased cases of poor service delivery following reports of maternal deaths arising out of medical negligence. What started as a probe into maternal deaths brought several old issues to the surface. During the operation, the State House Monitoring Unit and police arrested, among others, the Mbale Regional Referral Hospital Director, Accountant, Procurement Officer, Hospital Administrator, Plumber, and the store in charge on charges of neglect of duty and forging accountability. In forging of accountability, it was discovered that about 80 million shillings was reported spent on training health workers on how to use social media, that's WhatsApp, Facebook, and TikTok, an activity which allegedly never took place.
We are here to help you or to cause you account for what you have received. Full stop.
However, some of the health workers interviewed by the investigators denied having attended the training, despite their names being listed as participants. According to findings, the hospital management spent 350 million shillings on cleaners every year, and yet the facility is ever dirty. Spent a reported 28 million shillings on buying reams of paper during last financial year, among others. The arrests, officials indicated, followed a comprehensive and investigative review of expenditures that revealed significant misuse of funds by the hospital's top management. During the raid on one of the private clinics, 57 units of blood were recovered. Then, there are instances of missing drugs including ARVs, sodium bicarbonate, safe delivery kits, magnesium sulfate, oxytocin, and HIV test kits, and most glaring, the perennial extortion and brokering of patients by health workers to outside private health facilities. Add to the mix congestion in the hospital wards, littered with several non-functional equipment like broken beds in the wards, broken oxygen concentrator in the pediatric wing, and faulty lights in the wards, among others. Stephen Masiga, the Makerere University Mbale branch coordinator, says this is a normalized state of affairs.
Apparently, this is a referral hospital. It's not a localized facility like Bududa or Butaleja and others. It's a referral, where the facility must be stocked or must be deployed, or there must be sufficient consultants, people of high-notch expertise in medicine, so that when somebody is referred from Bududa to here, he gets the best of what? The services that they are able to give you. But that link is absolutely missing. Yeah.
According to investigations, the hospital leadership, among others, failed to, and I quote, effectively utilize resources to ensure quality healthcare delivery despite the funds being provided by the Ministry of Health, with cases of misappropriation unraveled. There was a noticeable disconnect between the hospital's management and the service delivery consultants. The hospital spent funds on non-essential activities, indicating a waste of resources, and although the hospital was generally clean, there were notable hygiene issues, largely due to significant reduction in funding for cleaning services, with blood-stained walls and clogged drainage.
Facility is below expectation. Of course, you are aware that many of the things they cover, they are unable to give the public the information on how many people die. But there are many deaths in Mbale Hospital. That's why many people who have some money around town, they go to private facilities.
Local leaders say they voiced their concerns to whoever cared to listen and tired.
And then we have those, the one whom I could call the independent bodies who come to investigate. Now the political and technical, they connive. When they connive, they go and they approach the investigators. And now the investigators also, they become compromised. That's why you don't see any results coming out. And at the end of the day, the person who has reported becomes vulnerable.
As leaders, we have been complaining about the service delivered, about our regional hospital. You know, for us, we have been suffering like mostly, for us, our patients from hard-to-reach areas. Once a patient travels from Bududa, Manafa, and Misindwa hard-to-reach area, and to the main hospital, expects to get a service delivery. Once you reach there, when you don't know anybody there, when you don't have cash, that means you either decide, you opt to go back with your patient, or you go and bury.
In the wake of the August operations, the State House Health Monitoring Unit returned to the location in late September to dialogue on a string of issues unearthed earlier. It was all bare to see.
We don't have any reason that is personal, but work. And I let my team, I want my team to start. They are going to go along, not in any order, but they will determine the order in which they make a presentation here. Drugs and medicaments. What did you receive? What did you use? What do you have? Why can't you account for? Money, you received X number of shillings. You used it so much. Where did you put the rest? You can't account for ABCD. Who among you cannot account?
I lost my mom 5 months back. Out of frustration, I was in Masawi and bought close to 8 million. I have those receipts. But in which my major concern was, Even water was getting water from outside. It's a government facility, though it is a private one, but look at the amount we are paying, but water was not there.
We all know as a hospital we are working at 22% of staff structure. It's a very big challenge. I think many of you have seen. We have very few staff, and the nursing department especially is very understaffed. And unfortunately, we have most of our nurses are almost approaching retirement age. So the level of sickness and the incapacity is extremely high. I have wards, for example, a ward like, I think a ward on average has about 50 patients, depending, 50 or 70 people. Sometimes you can only afford to put one nurse on a shift, which is a very big challenge. So sometimes you'll find us having to depend on students. So when you come to the ward and you find a lot of students and maybe one nurse, please bear with us.
There is a CT machine which was brought in Mbale Main Hospital, and that machine was declared a 31. But Madam Chairperson who is chairing now the session, when you go there, you find that that machine is still working, and people are using it up to now. And when they declared that machine a 31, they have never come out with a conclusive report pertaining that is that machine.
Here to help you or to cause you account for what you have received. Full stop. We are not here talking about inadequate money. None of us here has adequate money. Even Sudil does not have adequate money. He is still investing. So let's not divert this, otherwise we shall get off topic. Let us account. If you've been given 500 shillings, account for it.
Curiously, Mbale Regional Referral Hospital outperformed other 21 regional referral and private not-for-profit hospitals during the last financial year 2023-2024, according to the Ministry of Health's annual health sector report released last month. The hospital scored 64.8%, followed with a wide margin by Arua Regional Referral Hospital with 49.7% and Hoima Regional Referral Hospital with 47.1%. According to the ministry's report, while Mbale Regional Referral Hospital serves a large catchment area, it performed well on the different metrics. The hospital was established 100 years ago by the British colonial administration. The 415-bed facility serves more than 16 eastern Uganda precincts of Mbale, Mbale City, Busia, Budaka, Chibuku, Kapchora, Bukwo, Kwen, Butaleja, Namisindwa, Manafa, Palisa, Sironko, and Tororo. As a result, according to the Ministry of Health's 2024 report, the hospital had the highest number of admissions of 58,169 and deaths of 3,750 of all the 21 regional referrals and private not-for-profit hospitals.
Why would somebody deliberately curtail, deliberately fail a machine, a scan machine? He fails it to operate it, he frustrates this operation and tells you it is not working. Because he wants to refer you to his own clinic, which is located adjacent to the health facility. There must be a policy framework. We now challenge the Ministry of Health, State House, Health and Monitoring Unit and others to ensure that there should be no health facilities within a certain radius of the regional referral hospital.
The last time I went there, even reaching there, the mother passed on. Just because this mother was supposed to go and be scanned. Our scan was there, the CT scan. They told us that the one who works there is not there. It's only one person. He comes at a time that he wants. Another time I went there, they said they have taken it for repair. So they were directing somebody to go to another scan. But from my investigation, the scan was working.
Simple cases. You go to Butiro Health Center 3, you go to Bugobiru, which is supposed to be handled, they refer you to Mbale. And Mbale, after reaching Mbale, you will have to come back. Either you sell a plot, or you sell your calf, or your animal, before your patient is being handled, or before you are treated. So, where are we heading?
Curiously, even with the glaring corruption, bribery, high levels of absenteeism, Mbale Regional Referral Hospital was ranked the best during the assessment released last year in November, followed by Hoima Regional Referral Hospital and St. Mary's Lacho. The hospital received a non-wage budget of 7 billion shillings during the financial year 2022-2023 and 4.8 billion shillings during the financial year 2023-2024 for officials to play around with the money. While the Ministry of Health's report highlights that the hospital serves a big catchment area, which undoubtedly has bearing on quality of services, the ranking of being the best in the country quickly pales in the background of the endless revelations of corruption and wheeler dealing and complaints of extortion and bribery by locals and patients who have long decried the services offered by the facility.